अब प्रायः जसो पेसेन्टहरूको माइन्डमा के हुन्छ भने यदि मैले ब्रेसेस गरेँ भने 3 वर्ष त लाग्छ भन्ने हुन्छ हैन मान्छेहरूको सोच.
So patient ko overall appearance as well as his ability so as to conduct all these daily activities that is related to his face, speech, mastication, सबैलाई फरक पार्छ.
So is it safe to say that हैन 40-50 वर्षको मान्छेको पनि गर्न मिल्छ?
Yes, of course. I have few patients who are beyond 40.
Just for us to understand, clear aligner अनि braces मा what is the difference?
Aligners चाहिँ अब pleasing देखिन्छ and aesthetically it's like invisible.
बच्चाहरूको लागि पनि aligners have started coming in. There are so many companies which are manufacturing aligners even for kids. मैले braces लगाएँ भने मैले यो कुराहरू खान पाउँदिन, यो खाने कुराहरू बाँड्नु पर्छ अथवा braces गर्यो भने एकदमै दुख्छ.
Why not dentistry?
हजुर.
So dentists are actually better doctors, I would say. I think dentists, they are more close to their patients.
Orthoले smile लाई मात्र हैन तर हाम्रो फेशियल प्रोफाइललाई पनि इम्प्रुभ गर्न हेल्प गर्दो रहेछ.
नर्मली अब हामीले कसैलाई देख्छौँ भने माथिको दाँत चाहिँ थोरै अगाडि हुन्छ तलको भन्दा. क्रस बाइटमा चाहिँ के हुन्छ भने देयर इज टेन्डेन्सी टु प्रोट्रुड द जॉ. हामीले
ब्रेसेसको कुरा गर्छौँ, दाँत मिलाउने कुरा गर्छौँ, बट अल दिस इज भेरी भेरी रिलेटेड टु पेसेन्ट एजुकेसन एन्ड मोटिभेसन. के ब्रेसेसले साँच्चीकै नै अनुहारको शेपलाई परिवर्तन गर्छ? के 40 वर्षको मान्छेले पनि ब्रेसेस लगाउनु मिल्छ? अनि के हाम्रो दाँत सिधा भए पनि त्यसमा बाइट प्रब्लम्सहरू हुन सक्छ कि सक्दैन? आज हामीहरू यी कुराहरूको लागि डाक्टर आदित्य मल्लिकसँग कुराकानी गर्न जाँदैछौँ. नमस्ते अनि ब्राइट साइडमा डाक्टर निकिता अग्रवालको अर्को एपिसोडमा हजुरहरूको स्वागत छ. म तपाईँको होस्ट डाक्टर निकिता. यो पडकास्ट मार्फत व्यक्तिगत कथाहरू, इन्ट्रेस्टिङ कन्सेप्ट्सहरू अनि प्रेरणा दिने संवादहरू ल्याउने प्रयास गर्दछु. आज हामीसँग हुनुहुन्छ डाक्टर आदित्य मल्लिक, who is an orthodontist and a lecturer. उहाँले नेपालका विभिन्न संस्थाहरूमा प्र्याक्टिस अनि एक्सपिरियन्स लिइसक्नु भएको छ. अनि orthodonticsमा पनि fixed orthodontics, clear aligners, modern orthodontics. So we welcome you, Dr. Aaditya Mallik. And not only that, he's a very, very dear friend and a great father to a 1-year-old son. So we welcome you here.
Thank you so much.
So, Dr. Aditya, अब हामीले कुरा गर्दाखेरि हजुरले यो orthodontics भन्ने जुन सब्जेक्टमा विच इज बेसिकली अलाइनमेन्ट स्पेसलिस्ट हामी भनौँ न, म यही नै पढ्छु भनेर म यही नै गर्छु भनेर कसरी, किनभने डेन्टिस्ट्रीमा त यतिवटा ब्रान्चेसहरू छ नि, म यही सब्जेक्ट पढ्छु भनेर कसरी हजुरले निर्णय लिनुभयो?
आई थिङ्क त्यो कुरा चाहिँ अब एज अ डेन्टल स्टुडेन्ट मैले बिडिएस पढ्दाखेरि चाहिँ I observed all my teachers. And orthodontics was quite cool. It was relaxed. It was fun compared to our RCT Gorno, where you need to find a canal, wait for it, whereas other fields like prostho. So, त्यो सबै हेरिकन I think ortho was like more aesthetically pleasing as well as it was satisfactory for me at that time. So I thought, why not ortho? Why not something that changes the smile of a person?
हजुरले एकदम you picked up a very good point is किनभने अर्थोले चाहिँ नि पेसेन्टको स्माइल नै ट्रान्सफर्म गर्छ. अनि त्यही विषयको कुरा गर्दाखेरि सो एनिथिङ इन हजुरले पोस्ट ग्रेजुएसनको जर्नीमा आई हेभ नोन यु फर इयर्स नाउ, फर अलमोस्ट 7 years नै भइसक्यो होला है हजुरसँग भेट भएको. सो त्यो जर्नीमा एनी कुनै इन्सिडेन्ट्स अर एनी पेसेन्ट द्याट यु रिमेम्बर or your first patient of ortho where it was very satisfying, or how can you tell me any of the incidences जुन हजुरले एकदमै सम्झिनुहुन्छ or it was very rewarding?
So orthodonticsमा चाहिँ स्माइल अथवा अलाइनमेन्ट मात्रै नभएर we deal with various other cases like for example like functional appliances. So कुनै पेसेन्टको चाहिँ अब चिउडो अथवा चिन अगाडि छ भने so we use various appliances so as the jaw grows in the right direction. So for that, for example, I had used face mask. So face mask le patient ko profile ne change gardincha side but. So one of my patient, he was just 10 years when I first met him. So after completion of the treatment, he was around 12-13. So at that age, I could see a definitive change in his face. So tyo herikana I was really satisfied. he had a way more improved confidence, as well as his daily life had significant changes.
हजुर
So his confidence had boosted.
Mhm.
He was well oriented with his friends,
Mhm.
and I think it really helped him.
हजुर सो तपाईँले भनेअनुसार डक्टर आदित्य लाइक आई मिन हामी कुराकानी गरिरहेछौँ होइन अर्थको बारेमा अबाउट यर पर्सनल जर्नी आई थिङ्क आई वुड से अर्थो हामीले जसरी पेसेन्टको लाइफ नै एउटा ट्रान्सफर्मेसन गर्ने मौका पाउँछौँ होइन अर्थोमा
Yes.
एन्ड हजुरले जुन एउटा एकदमै इम्पोर्टेन्ट पोइन्ट के राख्नुभयो भने अर्थोले स्माइललाई मात्र होइन तर हाम्रो फेसियल प्रोफाइललाई पनि इम्प्रुभ गर्न हेल्प गर्दो रहेछ एम आई राइट
Yes, of course. So aesthetics लाई मात्रै prioritize नगरिकन, it
हजुर।
also focuses on the function
हो
as well as the structure.
हजुर
So patient को overall appearance as well as his ability so as to conduct all his daily activities
हजुर
that is related to his face, speech, mastication, सबैलाई फरक पार्छ.
राइट
So that affects all.
So to all the viewers who are watching and who want to understand, अर्थो भनेको दाँतलाई मिलाएर राम्रो देखिने मात्रै होइन तर त्यसले हाम्रो फङ्सनलाई पनि एकदमै राम्रो पार्दो रहेछ स्पेसली हामीले कुरा गर्दाखेरि खाँदाखेरि बोल्दाखेरि सो इट अल्सो हेल्प्स इन यर फङ्सन एन्ड चुइङ एफिसियन्सी एज वेल राइट
Yes.
Okay, and so this was about a little bit about your journey, the मैले बुझेँ होइन. Okay, I spoke about why ortho, or tell me about an experience. Next is why dentistry भन्ने कुरा. म डेन्टिस्ट नै भन्छु भनेर हजुरले कसरी सोच्नु भयो?
So being a dentist, त्यो चाहिँ अब plan चाहिँ थिएन, I would say,
हजुर।
right, frankly. So like any अब +2 science, biology पढिसके पछाडि, so most of us like we hope to become doctors.
हजुर
So I tried my efforts, with both Ministry of Education exams as well as various exams throughout the country. So by few marks I'll go like नपुग्ने रहेछ होइन. So second thought came to my mind, why not dentistry?
हजुर
So dentists are actually better doctors, I would say. Right?
Because
we
that
are
is a
more
debate.
Yeah, that's a debate, but
हजुर
I think dentists, they are more close to their patients.
true
Yes. So they often have a conversation with the patient. They come across the patients in daily practice. They not just change their daily life as well, they change their overall perspective.
हजुर
Okay.
हजुर
So I think dentistry, मैले choose गरिसके पछाडि, I think I did a good job.
So no regrets
I have no
whatsoever.
regrets.
Okay, good.
Especially orthodontics, no regrets.
Right. And no, Dr. Aaditya, because I have worked with you, I have worked alongside you. मैले तपाईँको journey पनि देखाएको छु. I know that you're a fantastic and you were a bright like student हजुरको पोस्ट ग्रेजुएसन डेजमा पनि. And so त्यो हेरेर I think, I mean, what you do, तपाईँको passion is actually seen in the work that you're doing day to day. होइन एन्ड यो त तपाईँको जर्नीको कुराकानी भयो होइन. अब जस्ट टु अन्डरस्ट्यान्ड फर लेमन, अब अर्थोडोन्टिक्स जुन हामीले भन्छौँ, तपाईँले जसरी भन्नुभयो नि, यसमा मान्छेहरूले के सोच्नुहुन्छ भने यो दाँतलाई सिधा पार्ने मात्रै हो. मेरो दाँत बाङ्गोटिङ्गो छ भने अर्थोको गएर दाँत सिधा बनायो भने द्याट इज वाट इज कल्ड एज अर्थोडोन्टिक्स. अफकोर्स हजुरले अघि भन्नुभयो कि यसले हाम्रो फङ्सनलाई पनि इम्प्रुभ गर्छ, त्यसलाई पनि गर्छ. तर यो अर्थोडोन्टिक्स ब्रान्चभित्र अपार्ट फ्रम दिस अरू के गरिन्छ भन्ने कुराको अलिकति जानकारी पाऊँ.
सो अर्थोडोन्टिक्समा चाहिँ अब ट्रिटमेन्ट पार्ट बाहेक we'd see of course preventive part हुन्छ. Right? Preventive part is the first thing. So before occurrence of the malocclusion or बाङ्गोटिङ्गो दाँत हुन अगाडि त्यो स्टेजमा इन्टरभिन गरेर हामीले what changes can we bring about. Right? त्यो बाहेक there is interceptive. Okay? Beside that corrective and surgical as well. So I would like to again recall one of my busy days. So my guide, Dr. Manis Bhattacharya.
Who's again a fantastic orthodontist.
I think he's the best right now.
Yes.
Okay. So after looking up to him, I would say orthodontics ko rule चाहिँ it's beyond what we see. So the transformation that a patient has before and after treatment, it can be drastic.
हजुर अनि हजुरले यो पनि भन्नु भइरहेको थियो नि द्याट यु नो इट्स इम्पोर्टेन्ट टु प्रिभेन्ट बाङ्गोटिङको दाँत होइन अब यो जरुरी छैन कि हामीले ब्रेसेस अथवा अर्थोडोन्टिक्स ट्रिटमेन्टको लागि प्रब्लम भएपछि नै जानुपर्छ भन्ने त छैन त्यो आउनुभन्दा अगाडि नै जान सकिन्छ सो यो कुरामा कतिजना पेसेन्ट्सहरूले पनि सोध्नुहुन्छ कि मैले अर्थोडोन्टिस्टकोमा पहिलोचोटि कहिले जाने भन्ने कुरा हुन्छ होइन सो वाट अकर्डिङ टु यु इज अ गुड टाइम अर द राइट एज अनि किन त्यो कुराहरू कि
So I would say the appropriate age would be around 7 to 8 years.
हजुर
So त्यो age duration मा चाहिँ patient is a mixed dentation period. So patient को अथवा को चाहिँ individual को दाँतहरू चाहिँ both permanent हुन्छ र primary हुन्छ. So patient को त्यो बेलामा हामीले intercept गर्यो भने we can prevent a number of malocclusions.
हजुर
or बाङ्गोटिङको दाँत अथवा अरू केही कन्सिक्वेन्सेस हुनसक्छ त्यसलाई हामीले समयमै उपचार गर्न सक्छौँ
सो यु सेइङ द्याट किनभने नर्मली कन्सेप्सन के छ अथवा कन्सेप्ट के छ भन्दाखेरि होइन 12-13 वर्षको उमेरमा नै हामीले यो दाँत मिलाउनतिर लाग्नुपर्छ तर हजुरले भने जस्तै 12-13 वर्षको उमेरमा 3-4वटा समस्या हुन्छ भने 7-8 वर्षमा नै हामीले त्यसलाई सर्ट आउट गर्यो भने त्यो त्यहाँसम्म पुग्दैन
पर्फेक्ट इक्जाम्पल वुड बी लाइक क्रस बाइट नर्मली अब हामीले कसैलाई देख्छौँ भने उहाँहरूको माथिको दाँत चाहिँ थोरै अगाडि हुन्छ तलको भन्दा सो क्रस बाइटमा चाहिँ के हुन्छ भने देयर इज टेन्डेन्सी टु प्रोट्रुड द जलाई नै अगाडि ल्याउने अथवा दाँतहरू नै अगाडि भयो भने तलको माथिको दाँतहरू भित्र ठेलिन्छ त्यसले गर्दाखेरि जको ग्रोथलाई नै इम्प्याक्ट गर्न सक्छ सो त्यसको लागि देयर इज अ मोर अप्रोप्रिएट एज इज बिलो 10 इयर्स सो राइट टाइममा हामीले इन्टरसेप्ट गऱ्यो भने त्यो चाहिँ पछिसम्मको लागि चाहिँ पेसेन्टको लागि इज बेनिफिसियल
अनि हामीले यो कुरा त गऱ्यौँ कि होइन पहिलाचोटि चाहिँ नि कहिले आउने तर इज देयर अ एज लिमिट जहाँसम्म भनौँ न कि वी अल नो द्याट वी हेभ पेसेन्ट्स हु कम टु अस एट डिफ्रेन्ट एज ग्रुप्स वेयर दे अल्सो एडल्ट्स एन्ड एडल्ट अर्थोडोन्टिक्स पनि हामीले भन्छौँ होइन सो वाट यु थिङ्क इज अकर्डिङ टु यु अब त्यो एज लिमिट जस पछाडि चाहिँ नि गर्नै मिल्दैन अर इज देयर एनी पर्टिकुलर क्राइटेरिया फर द्याट
त्यस्तो अब स्पेसिफिक क्राइटेरिया त छैन जेरियाट्रिक डेन्टिस्ट्री पनि हुन्छ अडल्ट अर्थोडोन्टिक्समा चाहिँ अब एज अ होल पेसेन्टलाई ट्रिटमेन्ट गर्नुभन्दा पनि कम्प्रिहेन्सिभ ट्रिटमेन्ट जे पेसेन्टको कम्प्लेन छ जे अब मल्टिडिसिप्लिनरी अप्रोच गर्नुपर्ने हुन्छ त्यस्तो केसेसहरूमा सो त्यो केसेसमा चाहिँ अब we can of course approach the patient with orthodontics so but then again we don't need to treat everything we need to treat what is the main concern so त्यो concernलाई treat गरिसके पछाडि overall चाहिँ function र efficiency मा चाहिँ improvement देखिन्छ
so is it safe to say that हैन 40-50 वर्षको मान्छेको पनि गर्न मिल्छ
yes of course I have few patients who are beyond 40 who are female patients who are visited after menopause. So त्यसले गर्दाखेरि it does not affect the orthodontic treatment.
त्यसो फरकै पर्दैन है Dr. Aditya, अर्को some commonly asked questions that the patients ask, I wanted to shoot that at you as well. अब प्रायः जसो पेसेन्टहरूको माइन्डमा के हुन्छ भने यदि मैले ब्रेसेस गरेँ भने 3 वर्ष त लाग्छ भन्ने हुन्छ होइन मान्छेहरूको सोच अथवा यो धेरै लामो समय लाग्छ यो उपचार गर्नलाई तपाईँले त्यस्ता पेसेन्टहरूलाई के भन्न चाहनुहुन्छ
सो इट डिपेन्ड्स अब पेसेन्टको केस कस्तो छ
हजुर
केस सेलेक्सन डिपेन्ड गर्छ कुनै केस अब स्पेसिङ नर्मली ग्याप भएको दाँतहरूमा देयर सर्टनली त्यो ड्युरेसन चाहिँ सर्टन हुन्छ
हजुर
अब कुनै केस जस्तै कि अब प्रिमोलर अथवा बङ्गरा सानो बङ्गरा दाँत हुन्छ त्यो निकाल्नु पर्ने स्थिति हुन्छ त्यस्तो केसेसमा चाहिँ देयर इज रिलेटिभली लङ्गर ड्युरेसन अफ ट्रिटमेन्ट But then exactly 3 years चाहिँ भन्न मिल्दैन I have treated cases with premolar extraction within 2 years as well. And त्यो चाहिँ अब डिपेन्ड गर्छ पेसेन्टमा डिपेन्ड गर्छ पेसेन्टको कम्प्लायन्समा डिपेन्ड गर्छ how well the patient maintains everything regarding the orthodontic treatment part है त्यसमा डिपेन्ड गर्छ 3 years is not a like standard time period.
Exactly. So I think it is subject to whatever the problem is अथवा कति करेक्सन गर्नुपर्छ
Yeah.
त्यो आधारमा पनि डिपेन्ड गर्छ एन्ड आइम श्योर देयर आर सम केसेस विच टेक इभन मोर देन 3 years.
More than 3 years, I have not
No?
faced any yet.
No, not yet. Okay, right. अनि डक्टर आदित्य सी देयर आर टाइम्स नाउ वी नो द्याट अहिले सबभन्दा अट्र्याक्टिभ कुरा नै भनौँ न मार्केटमा हेज बिकम क्लियर अलाइनर्स.
Yes.
I'm sure you've heard about how every single patient, now I'm sure your patients are also asking, Doctor, clear aligner गर्यो भने के हुन्छ हैन. अब just for us to understand, clear aligner अनि ब्रेसेसमा what is the difference?
Okay.
Plus अब कुन केसेसमा क्लियर अलाइनर्स गर्नु मिल्छ अथवा कुन केसेसमा हैन हामीले ब्रेसेसै लाउनु पर्छ भन्ने कुराहरू पनि देयर इज obviously a case selection also पनि हुन्छ नि त है.
Yes.
So how do we understand that whole perspective?
So to understand that, अब braces जुन छ traditionally used,
हजुर.
standard braces, अब त्यो चाहिँ has been used for longer duration. Okay. So the treatment outcomes are more predictable. Aligners को पनि predict गर्न नमिल्ने त होइन.
हजुर.
But again, there is certain lag with every set of aligners that you use. The treatment achieved and the treatment that was planned, there's certain discrepancy.
हजुर.
Gap देखिन्छ.
हजुर.
So now suppose 2 degrees of rotation or derotation हामीले प्लान गरेका छौँ भने
हजुर.
2 degrees नै देखिन्छ भन्ने हुँदैन अलाइनर्समा. But again on ब्रेसेसमा चाहिँ क्लिनिशियनको हातमा भयो. So clinician can judge as well as effectively apply the needed amount of force. Aligners चाहिँ अब pleasing देखिन्छ and aesthetically it's like invisible, close to invisible I would say. But then again about त्यसको case selection is very limited for now. So simple cases for spacing cases or simple mild crowding दाँत थोरै बाङ्गोटिङ्गो छ ग्याप छ दाँतको बिचमा त्यस्तो केसेसहरूमा चाहिँ अलाइनर्स इज वेल एन्ड गुड. बट देन अगेन दाँत निकाल्नु पर्ने केसेस छ अथवा डिप बाइट जुन भनिन्छ ओभर बाइट इन्क्रिज भएको पेसेन्ट जस्तै टोकाइ चाहिँ अलिकति अप्ठ्यारो छ त्यस्तो केसेसहरूमा चाहिँ आई वुड से फिक्स्ड इज द बेटर अप्सन. Braces is the better option.
So you're saying that simple cases-हरुमा mild crowding, अलिकति spacing-हरु भयो भने चाहिँ नि aligners-हरु गर्न राम्रो पनि हुन्छ, outcome is also predictable. But in case if they are more complex, cases like deep bite, cross bite.
Okay, so moderate cases-मा पनि नमिल्ने त होइन.
हजुर.
So auxiliaries जुन हुन्छ aligners-सँग युज हुने त्यो चाहिँ increase हुन्छ.
Right.
For example, अब अहिले चाहिँ introduce भएको very useful thing is temporary anchorage devices.
So
these are these are small implants that are placed in between the teeth or in the hard tissue. Right? So these help in the tooth movement. So with the use of TADs we can predict the treatment more effectively. But त्यसको पनि लिमिटेसन छ. पेशेन्टको कम्प्लायन्समा डिपेन्ड गर्छ. पेशेन्टको फ्याक्टर्स various factors हुन्छ. Every patient फरक हुन्छ. No two patients are same.
True. I think every patient and every human is different.
Okay. So त्यही भएर I'd say auxiliaries increase गर्यो भने चाहिँ we can go through various cases which are moderately treated. But difficult cases-हरुमा चाहिँ fixed ortho is the only option I think.
Right. Even now.
Or else the treatment is compromised.
What are the other benefits of clear aligners over braces? We discussed हैन अब हामीले यो कुरा गर्यौं कि कुन केसमा चाहिँ नि braces or clear aligners, but are there any specific benefits of clear aligners over braces?
Specific benefits भन्दाखेरि अब clear aligners are plastic, okay?
Right.
So they are placed over individual teeth सबै teeth दाँतमा हुन्छ. So त्यसले गर्दाखेरि चाहिँ segmental movement जुन हुन्छ एउटा segmentको movement is more effective.
Right.
Okay, single tooth movement भन्दा पनि a group of teeth को movement गर्न चाहिँ सजिलो हुन्छ. अर्को कुरा it is removable.
हजुर.
Okay, so removable भएपछि पछाडी the patient can take it out, effectively maintain the oral hygiene.
Oral hygiene maintain गर्न सजिलो
and replace it in the mouth.
हजुर.
So त्यो भयो भने it is more easier for the patient to keep a good oral hygiene. But त्यसको फेरि shortcomings के भयो त patient compliance.
True.
So whenever the patient wants, he can take it out, he or she can take it out and then again replace it. So that can affect the overall treatment outcome.
हो नि किनभने हामीले क्लियर अलाइनर्स के भन्छ भन्दाखेरि जति लगायौं त्यति नै त्यो इफेक्टिभ हुन्छ. अब त्यो रिमुभेबल भइसकेपछि चाहिँ नि प्राय जसो पेशेन्ट्सहरूले त्यसलाई झिकेर राख्दिनु भयो भने त त्यो the treatment ko purpose नै forfeit huncha ni ta.
Yes.
So I understand what you're saying. So it's of course that the more you wear it, the more effective it is. But that is also a disadvantage in some cases, and I think especially kids or bachaharu, where if there's a discomfort, kholerai rakdinchan. But yes, now we're also seeing that bachaharuko लागि पनि aligners have started coming in. There are so many companies which are manufacturing aligners even for kids, and aligners are supposedly becoming more popular because it's discreet, हेर्दाखेरि पनि क्लियर छ, ब्राकेटहरू ब्रेसेसकै मेटलहरू केही कुरा लगाएको देखिँदैन, त्यो हिसाबले they say that it is but we all know that if something has an advantage, it has disadvantage as well. Yes. And like हजुरले एकदम राम्ररी के point out गर्नुभयो भने fixed orthodonticsमा it's being controlled and regulated by an orthodontist who's sitting there and regulating it. Whereas in clear aligners, it's a software which has developed everything. So there is some sort of lag between the what is planned and what you finally achieve. So true. And another thing, Dr. Aaditya, like there is a common notion that मैले braces लगाएँ भने मैले यो कुराहरू खान पाउँदिन, यो खाने कुराहरू बाँड्नु पर्छ, अथवा braces गर्यो भने एकदमै दुख्छ. So what do you tell your patients, or what do your patients tell you? अब हजुरले यति वर्षदेखि अर्थो गरिरहनु भएको छैन, सो हजुरको पेशेन्ट्सहरूले हजुरलाई के भन्नुहुन्छ यस विषयमा?
So talking about fixed braces and fixed orthodonticsमा चाहिँ we need to use very mild force, minimal force required हुन्छ. त्यसले गर्दाखेरि चाहिँ orthodontic pain जुन हुन्छ त्यो चाहिँ minimally रहन्छ. So it depends on the patient as well. Patient को pain threshold कस्तो छ, how much is the pain threshold. अब specific मैले हेर्दाखेरि चाहिँ अब मेरो पेशेन्ट्सहरूमा I start with a very low force. So with that the patient has minimal discomfort.
So it's I think हजुरले एकदम राम्रो point के भन्नुभयो भने we should say that it's not pain, but discomfort can be expected.
It can be expected, yes.
Okay.
So as the treatment progresses, our patient gets used to it. So gradually the pain subsides. Normally the patient's pain subsides within 2 to 3 days, or let's say a week. This pasadi every appointment ma jab adjust garcham hami wire त्यतिखेर अलिकति पेन हुन सक्छ. But then again, as the patient undergoes the treatment duration, overall time ma patient को पेन चाहिँ reduce हुँदै आउँछ. अब स्पेसिफिक कुनै हामीले अब अप्लायन्स थेरापी युज गऱ्यौँ अथवा कुनै वायर बेन्डिङ युज गऱ्यौँ, त्यो गर्दाखेरि एक्टिभेट गर्दाखेरि अलिकति दुख्न सक्छ. बट देन अगेन त्यो पेन चाहिँ पेसेन्टलाई युज टु भइसके पछाडि दे आर गुड विथ इट.
So like you said, बिस्तारै, किनभने we are moving the tooth from their natural position to a new position. So त्यो मुभमेन्ट गर्दाखेरि अलिकति डिस्कम्फर्ट हुन सक्छ. That too, it subsides within 2 to 3 days.
Yes.
And what about the food? What do you usually tell your patients? अब यो खानु अथवा यो नखानुस्, हजुरले के भन्नुहुन्छ?
For every patient, before treatment only, I suggest a few things.
हजुर.
So among that, if you see, खानेकुरामा चाहिँ patient has to be very careful. So the food that is sticky or hard to chew, त्यस्तो खानेकुराहरू चाहिँ ask the patient to avoid.
हजुर.
खानु नमिल्ने त होइन, but then there's a risk of breakage of the appliance. So the bracket जुन हुन्छ, braces, त्यो निस्किने chances हुन्छ. So patient needs to be aware of that.
Right.
So depending on that, the patient needs to decide himself or herself कस्तो खानेकुरा appropriate हुन्छ.
Right. So basically, one message is that avoid sticky and hard food. Because that can complicate the whole treatment. Interesting. So I think those were a few general things that we discussed. Hey? Dr. Aaditya, let me just ask you another thing which I wanted to ask is, हामीले यो digital dentistry, AI, यसको कुराहरू कति गरिरह हुन्छौँ हैन? So अनि you are somebody who is young, who is following the recent technology, naya AI ko kuraharu. So what do you think? Like, how is AI and digital dentistry changing your field of orthodontics, or how is it helping it?
आर्टिफिसियल इन्टेलिजेन्सले चाहिँ हाम्रो काम सजिलो बनाएको छ चाहिँ सो इन्ट्राओरल स्क्यानदेखि लिएर डायग्नोसिस एज वेल एज प्लानिङ तिनटै पार्टमा चाहिँ अब एआईको युज चाहिँ ऱ्यापिडली ग्रो गरिरहेको छ अहिले सो पेसेन्टको कम्प्लेन के छ त्यसलाई क्याटेगोराइज कसरी गर्ने पेसेन्टको क्लिनिकली के देखिरहेछ त्यसलाई केसँग कोरिलेट गर्ने जसरी अब कुनै पेसेन्टको अब जमा प्रब्लम छ भने एआईबाट डिटेक्ट गरेर कुन डिस्क्रिपेन्सी कति छ हुनुपर्ने कति एक्सिड गरेको छ सबै कुराहरू थाहा हुन्छ त्यो थाहा भइसके पछाडि मोस्ट फेभरेबल जुन प्लान छ द एआई क्यान गिभ इट टु अस बट देन अगेन द मेन डिसिजन मेकिङ इज इन आवर ह्यान्ड्स सो हामीले चाहिँ त्यो कुरामा चाहिँ एकदमै केयरफुल हुनुपर्छ
राइट सो हजुरले भनेर छ लाइक एआई इज एबल टु प्रिडिक्ट दि कतिको डिस्क्रिपेन्सी छ कतिको एक्सेस छ त्यो सबै प्रिडिक्ट गरेर एआई इज एबल टु गिभ अ ट्रिटमेन्ट प्लान बट अगेन एआई इज यर थट पार्टनर like you said, it has to be verified by us humans and experts in the field. Right? And so Dr. Aaditya, हामीले यतिवटा ग्याजेट्स देखिरहेछौँ टुल्स देखिरहेछौँ what you see is the future of orthodontics अब होइन talking for our fraternity or उनीहरूको हिसाबले where do you see the field of orthodontics going now?
I think more clinicians are inclined towards intraoral scanners, use of intraoral scanners, जुनमा चाहिँ अब physical impression लिनु परेन पेशेन्टको
Which I think is a must now.
Yes.
Intraoral scanners.
It's very useful.
हजुर.
Next thing would be use of clear aligners. Okay. त्यही अनुसारले we can say patient motivation कुरा पनि एकदम important हुन्छ.
Right.
So patient education and motivation मा चाहिँ there is certainly increase as a use of
AI and
various
tools.
Yes.
And so like you said, I think it's a very, very important point होइन कि हामीले ब्रेसेसको कुरा गर्छौँ दाँत मिलाउने कुरा गर्छौँ but all this is very, very related to patient education and motivation, right? So as you said, I think there are a lot of AI tools which are helping in patient education, patient motivation. Do you also see अब होइन भनौँ आजभोलि अरू फिल्ड्सहरूमा पनि डेन्टिस्ट्रीमा पनि रोबोटिक्सको पनि युज हुन थालिसकेको छ नि त सो डु यु सी अ लट अफ रोबोटिक युज अफ रोबोटिक डेन्टिस्ट्री इन अर्थो मेबी आई डोन्ट नो
अब नेपालको कन्टेक्स्टमा त्यस्तो छैन अहिले आई थिङ्क सो
इट hasn't come here of course even हाम्रो साइडमा पनि
there is robotic wire bending
right
okay there is robotic AI based treatment planning as well as if you are using fixed braces there are tools to enable us to locate the areas where the brackets are placed so individual tooth ko morphology हेरेर individual tooth ko anatomy सबै हेरेर there are tools that can help to ease our process of treatment of the patient.
So definitely AI is going to be helping us in the future of orthodontics or alignment good treatment, right? And not only that, I think even jaw correction ko lagi pani AI is really, really helping to do that, right?
Yes.
True. And another very pressing question which I get, होइन अब प्रायः जस्तो पेसेन्ट्सहरूले कहिले काहीँ यो पनि सोध्नुहुन्छ डक्टर साहब मैले अलाइनमेन्ट त गरेँ सबै भयो अब मेरो ट्रिटमेन्ट त सक्यो होइन यु नो वाट आइएम आस्किङ इट्स अल्सो अबाउट वाट ह्यापन्स लाइक हामीले अर्थो ट्रिटमेन्ट सकिसकेपछि पेसेन्ट्सहरूमा रिल्याप्स देखिरह हुन्छौँ द्याट इज दाँतहरू जता जुन पोजिसन नयाँ ठाउँमा हामीले लग्यौँ त्यो फेरि फर्केर पनि आफ्नो ठाउँमा आउँछ यो किन हुन्छ एन्ड what do you think? Of course, we know retainers are needed, but what is the importance of that? And can you tell us a little bit about that as well?
So, what I would like to say is, orthodontic treatment गरिसके पछाडि it's just like over 50% of the work is done. So, some amount of work, 10 to 20%, or let's say beyond that, it's still remaining. So त्यो चाहिँ केमा आउँछ त रिटेन्सन फेजमा आउँछ. सो पेसेन्टको रिटेनर्सहरू जुन हुन्छ पेसेन्टले लाउन पर्ने अथवा वाट वी प्लेस इन द माउथ इज भेरी मच इम्पोर्टेन्ट बिकज द्याट इज गोइङ टु होल्ड द टिथ इन द फाइनल पोजिसन. सो त्यो पोजिसनबाट चेन्ज नहोस् भनेर वी गिभ द पेसेन्ट रिटेनर्स. सो द पेसेन्ट कम्प्लायन्समा पनि डिपेन्ड गर्यो एज वेल एज our judgment of needful appliance. कुन applianceले पेसेन्टलाई बेस्ट दिन्छ. सो लङ टर्मको लागि चाहिँ वी प्लान फर द रिटेन्सन. इट डिपेन्ड्स अन द केस. अब कुनै केसेसहरूमा चाहिँ माइल्ड टु मोडरेट रिटेन्सन चाहिन्छ, कुनै केसेसमा लङ टर्मलाई चाहिन्छ. सो डिपेन्ड गर्छ केसेसहरूमा.
Right, but like you said, just to make everybody understand, or just to put it in simple language, is that आफ्नो ठाउँमा मुभ भइसकेपछि we do not want the teeth to go back to its original position or move. अनि हजुरले भने जस्तै अर्थो अचिभ्स मोस्ट अफ इट, तर हामीले रिटेनर लगाएन भने चाहिँ नि त्यो फेरि त्यहाँ फर्किने ठाउँ हुन्छ, राइट? सो विच इज वाइ रिटेनर्स आर एक्सट्रिमली इम्पोर्टेन्ट. ट्रु. एन्ड सो डक्टर आदित्य, आई मिन युआर अल्सो अ लेक्चरर. हजुर लेक्चर पनि हुनुहुन्छ होइन? So I wanted to discuss a bit about that part of you as well. तपाईँ आफै एउटा डेन्टल स्टुडेन्ट हुँदाखेरि अनि अहिले भएको डेन्टल स्टुडेन्टहरू whom you're teaching, what is the difference that you actually see? One thing for sure is that, I think they have become more aware. Yes, they are more inquisitive.
Aware. Yes.
अनि they are asking उहाँहरूले सोचेको कुरा भन्नु पनि हुन्छ. They communicate very well as well, right? So what do you think? What else is?
So मेरो टाइममा चाहिँ I was like the first batch. So we were like unknown of dentistry.
हजुर.
Almost I would say.
NMC को first batch.
We didn't have seniors. Okay. So हाम्रो लागि सबै कुरा नयाँ थियो.
हजुर.
अहिले चाहिँ अब with every batch जुन मैले अब टिच पढाइरहेको छु, so there is a good relation between the seniors and the juniors. So त्यसले गर्दाखेरि they communicate a lot. They have a well orientation. As well as they are more into the subject. Okay, they approach the teacher as well as the seniors. They also are not just restricted to the books. So they have access to multiple sources.
Oh, your world is in your hand or in your finger. Dr. Aaditya, let's say you know that choosing orthodontics as a field. I was not a big fan of ortho, which is why I am a prosthodontist. But what is your message to somebody who is aspiring to become an orthodontist? अथवा मैले आफ्नो ब्याचलर सकाएपछि मास्टर्समा जाँदाखेरि म orthodontics नै पढ्छु भन्नलाई what do you want to tell them?
That would be a good choice for them.
Of course, coming from you.
Orthodontics is a very good subject. Right? You'll have satisfaction with the patients. Okay. But then with time you need to upgrade as well.
True.
Right? About daily kehi changes bhairahuncha. So orthodontics ma pani it's not untouched. So you have to be with the flow, go with the flow, as well as basic standard concepts also it remains the same. So you have to adhere to that as well.
I think you said it so beautifully, is that adhere to the basics, but keep updating yourself with everything that's constantly changing, right? Which is super duper important. And another thing that I want to know. So Dr. Aaditya, what would you tell your 10-year younger self? Like when you were about 10 years purano self, like what would you have told?
Not to stress much. Life happens, okay? It's a journey.
Yeah.
So just live it. Don't stress over anything. I think that's the main point of life.
Yeah. So go with the flow.
Yeah.
Be stress free, and life happens. I think that's super, super insightful. Fantastic. Now, Dr. Aaditya, there's something else that we will do, which we call as a rapid fire round. So I'm going to just ask you some questions.
Okay.
And then you can choose. Okay.
Is there a time period for that?
No. And there's no hamper.
Okay.
There's no hamper. There's no time limit, but we'll keep it simple. हजुरले one word अथवा one sentence मा पनि भन्न सक्नुहुन्छ.
That's what I'm good at.
Okay. So what does orthodontics mean to you?
It means my work, my job, what I enjoy.
Super. Braces or clear aligners?
I would always go with braces.
Of course. Any morning ritual that you have before you go for work?
I would say a cup of strong coffee.
That's what gets you going
Yes.
for the day, right? What kind of brush should you choose for orthodontics?
So there's a specific kind that is ortho brush.
Mm-hmm.
So which cleans the areas between the braces as well. So I would say that is the most appropriate one. But then again, it depends upon the habit of the patient. So patient like proper brushing technique थाहा छ भने, you don't need to specifically go with any brush. The normal brush is good, I would say.
And metal brackets or ceramic brackets?
It depends on the patient as well as the clinician. But then I would prefer the metal brackets. Because ceramic ones, they are, although aesthetic, they have a tendency to fracture or break easily. And the overall treatment outcome is more or less same. So, त्यो भयो र I think metal is good.
Lingual orthodontics in one word.
I'm unaware of it.
So it's a territory where I don't want to go.
Yeah.
Right? Okay. One instrument you cannot work without.
Of course, for every orthodontist, अब त्यो चाहिन्छ नै. It's a bracket holder.
So you can't work without a bracket holder.
Yeah.
True. One food that the patients who are wearing braces should avoid.
I think chewing gum.
Chewing gum.
Yeah. It's sticky. It gets in between the braces, dislodges them. Okay.
One oral hygiene tool that should be a best friend for the patients who are wearing braces.
That would be interdental brush. The small one. Okay.
हजुर.
It goes within the wires as well. So it cleans any debris that is remaining as well as the food particles.
So interdental brush.
Yes.
And what about your treatment?
Of course, the treatment is good.
So you say most of them compliment you for your smile. If you had to describe your journey in one word, what would you say?
I would say it is going terrific. I am enjoying it.
Something that you would like to tell the young dentists?
To face the challenges, okay? So if you come across any case that is out of the normal, try to grasp your knowledge from every other sources that you have. Do not hesitate to ask for help. Always approach your seniors or your colleagues and do what is best for the patient. Not just for yourself, but for the patient. Always think patient as your first priority.
Dr. Aditya, there is something new that we are going to do in this podcast. जुन हामीले प्रायः जस्तो गर्दैनौँ. It's called as myth versus fact.
Okay.
So भ्रमका कुराहरू अथवा त्यो साँचो कुरा हो हजुरले चाहिँ नि भनिदिनु पर्यो. Okay. Because these are things that I have seen patients asking. So I think it would be interesting to bust the myth.
Let's bust the myths.
Orthodontic treatment always takes 3 years.
It's myth, of course.
Magnets, they attach to the brackets.
Of course they would do, but then again, अब ferromagnetic छ कि छैन त्यसमा depend गर्छ.
Aligners work for everyone.
That's a myth.
Braces लगाइसकेपछि हाम्रो दाँतहरू कमजोर भएर जान्छ.
It is a myth, but then again, अब patient को periodontal health जुन गिजाको अवस्था कस्तो छ, हैन? Patient को दाँतको वरिपरिको हड्डीको अवस्था कस्तो छ. It depends on that as well.
So I think हजुरले भनेको कुरा एकदम इम्पोर्टेन्ट हो. यदि पेसेन्टको भएको दाँतको गिजाको बोनको हेल्थ अनि क्याभिटिजहरू भएन भने टिथहरू विक हुने चान्सेस चाहिँ नि एकदमै कम नै हुन्छ.
Yes, of course.
पेसेन्ट्सहरूले 30, 40 अनि 50 को उमेरमा पनि ब्रेसेस लगाउन सक्नुहुन्छ.
That's a fact.
Truth. ब्रेसेस एकदमै पेनफुल हुन्छ.
That's a myth.
So as we discussed, there can be discomfort, that too for some days.
For a few days.
तर एकदमै पेनफुल चाहिँ नि हुँदैन. ब्रेसेस गरिसकेपछि पनि बाइट प्रब्लम्सहरू हुन सक्छ.
Now it is also can occur, it cannot occur.
So partially correct.
But the treatment objective is to not have any. So I would say that's a myth.
Chewing gum ले braces लाई destroy गरिदिन्छ.
Destroy नि त गर्दैन, but then again it can affect the कहिलेकाहीँ
Right.
some scenarios मा चाहिँ निकाल्न सक्छ.
So it's better to avoid.
Yeah, it's better to avoid
having chewing gum, sticky or hard food.
hard food.
Yeah, I think that was fantastic, and thank you for busting all the myth and helping us with the facts.
Thank you.
As we come to the end, Dr. Aditya, of this podcast, there is something that I ask all the guests who come. What is the legacy that Dr. Aditya wants to leave behind?
I would say one has to be down to earth, grateful always, and always one has to look forward to learn something new. Time, there are different things that evolves. You always have to be updated. That is important.
What is the last thing that you want to tell all the viewers who are watching this podcast?
I would say let's focus on the orthodontic treatment part.
Hajur.
You don't need to be fearful of it. You need to consult your doctor, plan a treatment, and do what's most favorable for you. Okay? So त्यसमा compromise हुन सक्छ, but then again the treatment outcome should be more or less what is desired by the patient. That's it.
Right. So I think it's a very, very important message is that orthodontic treatment, make sure that you're doing it after consulting, and don't be scared of orthodontics, because that will ultimately help in alignment, and not only alignment but also function.
Yeah.
Right? So thank you so much, Dr. Aditya, for joining us today. It was an absolute pleasure.
Thank you
and
so
honor
much.
to have you here. अनि हजुरसँग कुराकानी गरेर I'm sure हाम्रो viewers-हरूले धेरै कुराको जानकारी पाउनु भएको छ, and a lot of the confusions have also got cleared. Thank you so
I hope
much.
so. Thank you so much.
Thank you so much, Dr. Aditya, for joining us today. I'm sure our viewers have highly benefited from today's podcast. अनि उहाँहरूले बुझ्नु पनि भयो होला कि orthodontics भनेको दाँतलाई सिधा पार्ने मात्र होइन, but it is also about having a good function, chewing efficiency, and lifelong confidence. So all those who watched, thank you for staying with us, and remember to like, share, and subscribe. This is Dr. Nikita signing off. अब दिनमा 2 मिनट 2 चोटी ब्रश आफ्नै लागि